Hello everyone. This is about antenatal scan of a 24-year-old lady with 4 months of amenorrhea. The images are self-explanatory. I'm giving 3 questions. The first question, what are all the findings? The second question, give the complete diagnosis. The third question, what are all the types and the incidence of each? The sonographic images are at least 15 years back. They do not look majestic, but the images are still very diagnostic. If you want more time for the diagnosis, pause the video and go back to assess the images. Within few seconds, I'll give you the findings in the complete diagnosis and then go for the discussion. Are you ready? Let's go. Twin intrauterine fetuses are seen with fusion of anterior chest and abdomen of the twins with single heart and 2 separate stomach. No other images had been given, but no other anomalies were detected in the fused twins. There was single placenta with appropriate fetal biometry, especially by BPD, HC and FL in the fused twins. The diagnosis is thoracopagus type of conjoined twins. Now you can see the picture of the abortus of the conjoined twins due to spontaneous abortion which happened few weeks after the scan. Now before the discussion, please remember the numbers 10 to 14 and 75. 10 to 14 and 75. Please don't forget these numbers. We will talk about the basic information about the formation of monochorionic twins. I mean identical twins. After intercourse, one sperm penetrates the ovum and the fertilized egg is called as zygote. And it divides fastly as 2, 4, 8 and 16 cell stage. And then it is called as morula. This morula happens in 1 to 3 days. Then it becomes a mobile blastocyst on 4 to 8 days. This blastocyst becomes implanted on 8th to 13th day. Then it becomes as an embryonic disc on 13th to 15th day. This can be duplicated to form identical twins. So it will be a single one. This can be duplicated to form the identical twins. If it is duplicated or cleavage during morula stage on 1 to 3 days, we will have dichorionic diamniotic identical twins. If it happens during early mobile blastocyst, we will have monochorionic diamniotic identical twins. If that happens in an implanted blastocyst, then you will have monochorionic monoamniotic identical twins. If the cleavage occurs after formation of an embryonic disc on 13th to 15th day, we will have conjoined twins. So conjoined twins is defined as fusion of monochorionic monoamniotic twins with the degree of fusion of the twins which might be splitting rest of the parts. This happens embryologically at 12th to 15th days. The parts fused and the degree of fusion determine whether to name the fused parts or the separated parts. Now we will talk about the numbers 10 to 14 now. When a morula is duplicated at 3rd day of conception, you might have dichorionic diamniotic twin as already described. And if the mobile blastocyst is duplicated at 6th day, you might have monochorionic diamniotic twin. And if the implanted blastocyst is duplicated at 10th day, you might have monochorionic monoamniotic twins. So till 10th day, no problem at all. But if the embryonic disc is duplicated later to it, later to the 12th day, then you might have conjoined twins. For example, if the embryonic disc is separated at 12th to 13th day, the conjoined twins might be either thoracopagus, which can be 18% of the conjoined twins, or omphalophagus, which might be 10% of conjoined twins, or might have less fused equal or imperfect conjoined twins. Okay, but the same if the embryonic disc is separated at 13th to 14th day, the conjoined twins might be either thoraco-omphalophagus or might have more fused equal or imperfect conjoined twins. Now later, if the embryonic disc is separated at 14th to 15th day or more, it is highly variable and the conjoined twins might look highly distorted. Till now, we have been talking about embryonic division happening during 10 to 14 days from normal monochorionic monoamniotic twins at 10 to 12 days and formation of conjoined twins from 12 to 15 days. Now we will go to the same number 10 to 14, but now it is in weeks. That's the number during the antenatal scan. Most of the conjoined twins are usually diagnosed by antenatal scan at 10 to 14 weeks. Most commonly during NT scan at 11 to 14 weeks. Sometimes it might be diagnosed later due to tiny or minimal fusion, example fusion of tip of the little fingers or toes. On the other side, many named conjoined twins like thoracopagus or ischiopagus have been reported even at 7 to 9 weeks. After this, we will go for classification of the conjoined twins. It is totally different in each of the specialties, and it is varied by the detection or by the prognosis or by the management. Whatever is said and done embryologically, it is the same with so many classifications. But the most favorite and the oldest classification of conjoined twins for monozygotic twin remains the same, which had been suggested by Wilder during 1970s. In his classification, he gives 4 types of conjoined twins. First one is free monozygotic twins with minimal fusion. They are almost normal symmetrical twins with fusion of only small parts. Already discussed as fusion of tip of the little fingers or toes. It gives the best prognosis as they are easily resectable with no complications or less complications. Second one is the most common equal or perfect conjoined twins. That's the most common type of conjoined twins. The incidence is well known, and most of the medical books describe in detail about the staging and classification and incidence of the subtypes. We'll talk about the subtypes. The first one, the anterior fusion, is the most common type of equal conjoined twins with 40 to 50%. That can be either thoraco-omphalophagus or thoracopagus or omphalophagus with fusion of heart or stomach or both. The second one is the posterior fusion, which comes to 18 to 25% of the conjoined twins. The most common portion is called as pygopagus, which is joined at the buttocks. Third one, the lateral fusion, which comes to 6 to 10%. The most common portion is called as ischiopagus, which is joined at the ischium. The fourth one is the cranial or facial fusion, which is called as craniopagus or cephalopagus, which comes to 3 to 5% of incidence. We talked about the free monozygotic twins with minimal fusion. The second one, the most common, equal or perfect conjoined twins. The third one, less common, it's called as unequal or imperfect conjoined twins. The incidence is varied in different countries, and in a country it is variable in the different states of the same country. This type of conjoined twins is usually described by the areas of non-fusion. 2 best examples are dicephalous, which means 2 heads separated in 1 fetus, and dipygus means 2 pairs of legs in 1 fetus. So there are so many other types do exist, and will become too much for this discussion. We'll go to the last one, which is called as heteropagus or parasitic twin. In this type, there will be a fully developed twin with an incompletely formed soft tissue attached to the fully developed twin. The incidence is rare, about 1 in a million. Here the parasitic mass will be attached to one of the 8 areas in the well-developed fetus. The focally fused areas will be the same as already discussed in the equal conjoined twins. I mean, if that parasite becomes attached to thorax, it is called as thoracopagus type of parasitic twin. Likewise, the parasitic twin could be omphalophagus, craniopagus, cephalopagus, parapagus, ischiopagus, rashipagus, pyopagus. I would mention the fact that few authors include the fetus in fetu and the fetus with teratoma, might be including them in the parasitic heteropagus type of conjoined twins. Now we come to the 75 number. Just for remembrance and easiness, I am taking this number 75. The first one, the incidence of conjoined twins during antenatal scan is almost 1 in 75,000 intrauterine pregnancies. The second one, 75%. So 75% conjoined twins is females, very important, 75% almost. The third one is more than 75% of male conjoined twins are either stillborn or they demise as a neonate. Fourth one is 75% conjoined twins are equal symmetric conjoined twins. But the incidence of live conjoined twins after birth, especially after a month, might be varied from 1 in a lakh to 1 in 2 lakhs worldwide. The incidence of conjoined twins is slightly more common in Arabic countries and in South Asia. Lastly, now I am attaching a video. I was stunned while seeing this video in the YouTube few years back. You can see the entire video again and again. I am giving a question. Now tell me, what is the type of this conjoined twins? Please give your answer in the comment section without fail.
देखा था तो काटा लगा हाँ मन को ध्यान नहीं करा था तुम
कहाँ जाते हो भी?
कहाँ जाता बेटा, कहाँ जाता?